Hello, everyone. My name is Mike Morris. I'm the co-director at Writing on the Wall. Welcome to tonight's event. I hope you're well, and thank you for taking the time to join us tonight. I just want to explain a little bit of housekeeping. You have control over your camera, so you can have it on or off. It's up to you. We are trying to create this as far as possible as a live event, and it would be great if the speakers can see your face. It makes it nice and friendly. It makes us all feel like we're in the room. So if you can, put your camera on. We don't mind if your house is a little bit untidy either. If you want to keep it off, obviously that's your choice, no problem at all. You don't have control of your microphone. If you do want to ask a question when we get to the Q&A, you can use the raise hand function, which is at the bottom of your screen, and then the tech will unmute you and a small box will appear on your screen. All you have to do is press it to unmute, and then you can ask your question in person. Alternatively, in the chat box down below, you'll find the WOW moderator, and you can send a question to them, which will be fed through to the panel during the discussion as well. So welcome to Writing on the Wall, and tonight's event celebrating the launch of a radical practice in Liverpool, the rise and fall of Princes Park Health Centre, which is part of a series of month-long events celebrating WOW's 21st anniversary. For me, this is one of our proudest moments in the festival. And after I first spoke to Katie Gardner in October 2019 about Writing on the Wall publishing this book, this is the culmination of over a year's work on the publishing side and really a lifetime's work for Katie and Susanna to bring this absolutely wonderful book to publication. The coronavirus and the lockdowns has really shone a light on just how vital community healthcare is. And as the book demonstrates, Princes Park Health Centre, with its person and community-centred approach, is a model of the type of health practice required, not just for outbreaks of this nature, but also for ongoing healthcare and engagement with communities. And I think that they've done a real service in capturing that health centre, capturing the time that they worked in whilst they were there, and drawing out some things that I think will be vital for us going forward, well for today and in the future too. A radical practice draws on the vivid memories of patients and community activists, as well as health workers, and it's set in the political context of the time and reflects the turbulent history of the National Health Service over the past 40 years. Our host tonight is the legendary broadcaster Roger Phillips, who joined the Princes Park Health Centre in the early 70s and describes it in his preface to the book as a practice like no other. Roger was the voice of Radio Merseyside until his retirement in 2020, winning countless awards throughout his career, and is now the visiting professor in broadcast journalism at Liverpool Hope University. Really grateful for Roger for chairing this session. So please give a big virtual round of applause as we welcome Roger Phillips to the screen to begin tonight's event.
Thanks very much indeed, Mike. I don't know about legendary, but anyhow, retired's fine. I'll just quickly outline what's going to happen at this event. For the next 45 minutes, we'll hear from 4 speakers, all of whom are or have been closely connected with what is, as Mike says, an extraordinary practice. I'll introduce each one as we go along, and after they've all spoken, they'll be followed by you, your questions and discussion, which I'll chair. So do have your questions ready as you go along, have a good think about it, and we'll end no later than 9 o'clock. But can I first briefly tell you, as a previous patient, of my reaction to this book, including some short quotes from it. It is extremely readable, and it's really interesting for anyone who's concerned about the development of the health service, where the NHS is now. But it's also a valuable history of the south end of this city, genuine mix of lovies and real people. Siobhan Riley helped with the Family Health Project, record keeping and project evaluation. She puts it really well. PPHC seemed to be at the centre of where any action was. I don't think many of the organisations that sprang up after the 81 riots would have done so without input from PPHC. It's a story of a community and a community centre. It's self-critical, it's the good, the bad and the ugly, but the good does massively outshine the rest. And there's some memorable stories. It's a moving book in some places. Dr. Katie Gardner, who's one of the authors and who we'll hear from shortly, writes beautifully about a 7-year-old girl with cancer. And I quote now, "She came home to die and I stayed up all night with her and her single parent mum. She died peacefully in the early morning of a beautiful summer's day. The birds were singing as I went home. And there's humour as well. She writes of an elderly patient who was very unwell with a urine infection. He was rambling a bit. He kept mentioning goats all the time. To her surprise, she looked out the window and saw 2 goats in his backyard. And she writes, the patient is almost always right. Another GP, Paul Thomas, recalled a poignant moment. He writes, it was a weekend that Maya Angelou was in Liverpool, and I did the usual Saturday surgery. Then I wanted to go and get a copy, or my copy of I Know Why the Caged Bird Sings. I wanted to get it signed. I was looking after a patient who was dying at home. I wasn't on call, but I routinely made private arrangements with my dying patients, that including being there for them at all times. I'd arranged to get an update from the patient's relatives at the Royal Philharmonic Hall after Maya's presentation, but I couldn't find them. Later, they told me that they were going to tell me that she was fine and there was no reason for me to visit. I then went to the Caribbean Centre, which is around the corner from the patient's home. The lack of reassurance played on my mind, and I said to the mum, can you look after my rum and coke? I have to walk round the corner to see someone. I knocked on her door to be met by the Macmillan nurse, who said, thank you for coming so quickly. Of course, I had no idea that had been called. The patient was having a terminal hemorrhage, and I remember holding her hand in her distress. Time stood still. The nurse and I sat and waited for a while. The room was pregnant with peace. It was beautiful. Then I noticed a book at her side, the bookmark indicating that it was already part read. It was I Know Why the Caged Bird Sings, signed by Maya Angelou. A trainee, Dr. Catherine Thomas, tells the story of how she will never forget the very elderly gent who convinced her in the early hours that the grey parrot in the corner was older than he was. Dr. Rob Poole, who worked for 16 years from 1988 as a full-time NHS consultant psychiatrist in community mental health teams in Toxteth and Liverpool City Centre, makes the point that PPHC was the starting point in so much. The benefits were widespread. There are numbers of doctors, nurses, psychologists, social workers, researchers, receptionists who came through or who were trained at PPHC. The benefits to them and to patients way beyond Princes Park Health Centre. Pro Torkington, great researcher and academic who worked closely with the practice for many years, writes, health is a political issue. I cannot understand how doctors can fulfill their professional work outside political considerations. I was pleased to find out that Princes Park Health Centre was right at the centre of the NHS and political landscape. So very true. The story of Princes Park Health Centre reflects a turbulent history of the National Health Service over the last 40 years, a visionary practice. Every health service worker and every politician should be forced to read this book. As I said, one of the authors is Katie Gardner, our first speaker. Katie joined Princes Park Health Centre as a trainee in 1978, soon after it opened. She became a partner in 79 and stayed for a few years, 28 in all. After leaving, she went on to work at the Marylebone Health Centre in the Vauxhall area of Liverpool. Katie retired in 2018, having been active in community projects and public health, especially in Liverpool 8, all her working life. So, over to you, Katie.
Oh, hi. Oh, thank you, Roger. Oh, I just want to cry now. Anyway, so welcome on behalf of Susanna Graham-Jones, who's here somewhere. Hi, Susanna, and myself. As Roger says, I've been a GP in Liverpool for 40 years, and Susanna and I felt this story needed to be told. Dr. Michael Jonachet, who's also here, he put it, I think the NHS is increasingly revisiting the values that were once prioritised at Princes Park Health Centre. I'd just like to thank all the contributors, supporters, our great panel today, most of all to Susanna for being very patient, putting up with me and very, very thorough. And thanks to all the patients and staff of Princes Park and to Brownlow Health for taking on the practice. Thanks to the lovely people of Liverpool 8 and all our editors, Writing on the Wall and News from Nowhere. And just to say, we the panel won't be naming or commenting on named groups or individuals today, except with explicit permission from those groups. So the health centre opened in 1977, a one-stop shop for Toxteth in Liverpool 8. Itself a really lovely and wonderful, diverse, but very deprived inner city part of Liverpool. The health centre was the vision of Dr. Cyril Taylor. He started as a single-handed GP in 1950, and the health centre was his dream. In 1980, having created the health centre, he wrote, "To be a community-orientated doctor means involvement in all aspects of the community's healthcare needs. It also means forming an alliance with the community to resist forces, political, social, and environmental, which make for ill health." It is 50 years since Cyril's great friend, Dr. Julian Tudorhart, a South Wales GP, coined the term the inverse care law, saying that the quality of healthcare tends to vary inversely with the deprivation and the needs of the population. And Julian's influence runs throughout the book, while we tried to combat the inverse care law ourselves. And so to Princes Park. Chas Clegg, who was a district nurse at Princes Park and started our first Well Man clinic, said, "I was once at a meeting where the practice was described as Reds under the beds. I took that as a compliment because at the time, Margaret Thatcher was on top of the beds trying to dismantle the health service." Well, nothing much has changed there then. So throughout our 40 years described in the book from 1977, Princes Park was about seeing the bigger picture, about working together with local organisations and academic departments to solve problems. We identified issues and then we did something about it. Oh, so sorry. Oh, God. Sorry, that's to remind me to take my tablet, sorry. We identified issues and did something about it. So, and then many examples in the book, including healthcare for homeless people, leading to the social inclusion team that we have in Liverpool today. Trying to address inequalities in healthcare for Black and ethnic minority communities, leading us to ethnicity monitoring and beyond. Discovering and combating severe vitamin D deficiency in the Somali community and then the Yemeni and South Asian communities. The appendix, Princes Park, as a public health organisation, describes all that. I recommend it. We also were one of the first practices in Liverpool, and certainly I think probably in the country, to introduce race equality training after the Toxteth riots in 1981 with Rashid Mufti, who many of you will know. And at the same time, the team in Princes Park went that extra mile in caring for patients, and Roger has described some. We visited astonished patients in hospital, very unusual. We went to benefit tribunals, which we often won. We provided clothes and food for patients that we found to be in need. Julia, a patient, said, "You felt valued as a patient and as a person. You could talk about your problems, even if they weren't strictly medical." We often took extra time with patients, and I was a prime culprit. I always ran late, and I've invented various systems to overcome it. But Ria Hayward, who is a counsellor, in the 90s said, "My view, which I told the GPs and the patients at the time, was that running late saves people's lives." And I agree with that. Princes Park was also a place of fun. We had an arts festival in 1992, and people wandered through the waiting room on stilts, much to the bemusement of the patients and amusement of the patients as well. We had Cyril Taylor on a bicycle dressed as Santa delivering Christmas presents in the waiting room. However, in the 90s, Thatcherism bit, and we couldn't find or recruit doctors. It was very difficult. So in 1997, the Tories introduced a salaried service, which was new. And Princes Park thought, let's be pioneering and radical and become a salaried practice. We did do that. And then we found that we lost control and became at the mercy of organisations which didn't really understand us and were passed from trust to trust. There are lessons for today in what is the political agenda of the legislation that's being passed and what is really on offer here. And a word on privatisation. GPs have always been a private in a sense because they were independently contracted to the NHS, and salaried service came much later. And there's been great variations in general practice throughout the years. But at their best, as GP Louise Irvin recently wrote, GPs were embedded in their communities and they were seen as an integral part of the NHS. More recently, in 2004, as Louise reflected, another new GP contract laid the path open to what Louise called GP doctorpreneurs, who appeared to take advantage of opportunities provided. Our health centre was taken over in 2012 by a GP business, which didn't appear to share our values. And that was difficult. However, for me, it's not about private or privatisation. It's about the ethos. Why are we doing this job? Surely we're doing it to provide the very best care for our patients and our communities. Luckily, what Brownlow Health, who took the practice over more recently, is doing is exactly that. I just want to say a tiny bit about vitamin D. Discovering vitamin D deficiency in the Somali community, completely hidden, led me on a journey. I'm not a fanatic, but recently a patient or a person contacted me who had long COVID, in quotes. They probably do have it. Unfortunately, they also had vitamin D deficiency, but their very enlightened GP tested them for vitamin D deficiency, treated them with high dose vitamin D, and many of their symptoms of lethargy and muscle pains and tiredness got better. So it is something to think about. So just in conclusion, at its best, Princes Park embodied everything that I believe primary care should be about. Lots has changed over the last year, and I know it's been really difficult, but it has given us an opportunity to revisit the values and lessons embodied in this book. I do really hope that you will enjoy it, and thank you so much.
Thank you, Katie. Really nice first, and thank you also for writing it with Sam. It's a brilliant book. Right, we move on now with Teresa Williamson-Akpan. Teresa's an activist well known in the city, campaigner for many things, been a patient at Princes Park Health Centre for over 40 years. She was involved in a successful campaign run by the late and great Sam Samoff, another patient, another activist, to rescue the rundown and demoralised health centre after its takeover in 2012 by the GP company referred to by Katie. Teresa believes that Princes Park Health Centre was groundbreaking, she's not wrong there, and ahead of its time, and is worthy of recognition for all it has achieved. Over to you, Teresa.
Thanks, Roger. I arrived at Princes Park Health Centre by chance. I'd had a baby, they had a baby clinic, and I stepped outside my front door and there it was opposite. First impressions, huge space, welcoming, friendly, bright. I immediately registered as a patient and have been there for more than 40 years. Our great friend, Sam Samoff, who was known for the campaign against Carillion and the PFI at the Royal Hospital, who, as Roger said, was a patient. He was giving us information about what was happening on the inside because he was attending every week on a regular basis. And he told us about people queuing up at 7:30 in the morning to try and get appointments. People were phoning in and couldn't get appointments, or they were told to go online. And as you know, if you don't have technology, you have no access to that. 2012, it was taken over by the private practice. And things started to fall apart. So we were fobbed off by the clinical commissioning group when we complained about it. And so as members of Keep Our NHS Public, we decided to start a campaign to get this surgery back under the NHS. We decided we would produce a leaflet in 3 languages and leaflet the whole demographic of Princes Park. And it was in English, Arabic and Somali, which was the main demographic, but community supporters did speak to other people who were non-English speaking as well. We leafleted, we demonstrated outside the health centre with placards with different languages. And we did all of that with the different languages to make sure that the community felt involved. We decided that we would do a public meeting to be held in the community in Liverpool 8, because some people in the community don't like to go out of a night if they found it quite frightening or what have you. And if I could just say thanks to Michelle Charters from Cumber Amani, who Sam went and spoke to, and she supported our campaign completely and decided to give us 3 rooms to use free of charge, because again, we decided this meeting was going to be held in 3 languages. Great idea, but we didn't know if it would work. I remember when we organised the meeting and it came to the day, we set up, we'd already booked all the speakers like Katie, public health people past and present, nurses. And I remember Sam saying to me half an hour before the meeting, Teresa, what happens if nobody turns up? My response was, Sam, the community cares about each other. Princes Park Health Centre cares about the community, and they will come. And they did in abundance. It was vibrant, vocal, and ready for the fight. I loved the young people whose families were non-English speaking, who came in with parents, friends, family, and grandparents. And they were telling me, oh, I speak English and Arabic, or I speak English and Somali, but I'm going to go into the room where they're doing the interpreting so I can support my family, because the sound system was hooked up so it could all be done live. It was just amazing. And it was amazing to hear the young people engaged and vibrant. We had great speakers who gave the history of Princes Park, spoke of the situation and what our intentions were to return Princes Park to good health, which would restore good mental and physical health in the community. I think the most important part of the meeting was listening to the patients, family members and carers who were sharing their stories, worries and fears going forward for the health centre, because we did think that it maybe end up closing, and that would have been a big disaster. Everyone respected the speakers. After the successful meeting, which went without a hitch, I have to say, all the information was collated and it was sent to all the relevant bodies, Clinical Commissioning Group, Care Quality Commission, NHS England, and anyone who needed to be in the loop to know what was going on. The CQC had been in and inspected the surgery, and they found some minor failings, but we knew that wasn't the full picture. So we brought together patients, carers again, and we held a meeting with the CQC, and they did a second inspection, and it was actually put into special measures, total disaster again. We were concerned about this, that it may be closed down. But luckily Brownlow Health were brought in to run the surgery temporarily and to try and bring it back up to a standard that was acceptable. They had to come up with a plan to restore it so that it could function and people didn't have to queue up outside for appointments, especially if they were sick, or if appointments were cancelled because the locums didn't turn up. That's not a great way to run any healthcare system. To be fair to Brownlow, they pulled the surgery up very quickly and the patients were able to secure appointments without queuing outside. Lots of patients had left, which was quite sad, but then a lot of them started to come back once it had been taken over by Brownlow, which was great, because some of them had been there 20, 30 years and it was really sad, but their health was so important that they had no choice but to leave. I think after we'd held the meeting and it was the total success, we worried going forward who was going to take over the surgery long term. We found out where the tendering meeting was going to be held on Ullet Road. We turned up en masse. We weren't allowed into the meeting, but we did say to all the people who were going in to try and capture this surgery, don't bother going for Princes Park Health Centre because we want Brownlow to run it long term. And, you know, they said it's up for anybody, etc., etc. And to conclude, I would just like to thank all the people who were involved in the report writing, 100-page report, which is exceptional, that anybody can access online. They trawled through tons of paperwork to find what was actually going on, and I personally couldn't do that. And to thank all the people in the community who did all the translations on the leaflet and did all the interpreting at the meeting. I'm glad I'm there, and I'm just going to finish now because my 7 minutes are up. But such a great job that all who past and present have worked there. It's just amazing. Thanks to all the doctors, the staff, the receptionists, all the healthcare workers, and I hope to be there for the next 60 years. Thank you.
Thank you, Teresa, and thank you for working so hard to save the core, the values of that great practice. Now then, Michelle Cox. Michelle's a registered nurse, passionate about the delivery of high-quality healthcare. She's got loads of experience in the commissioning of health service and uses that experience to influence health and social care policies in relation to inequalities in health at many levels. As North of England lead nurse to the Chief Nursing Officer's Black and Minority Ethnic Strategy Advisory Group, very snappy title, Michelle focuses on equality, diversion and inclusion. And amongst many awards, Michelle was given the title of Queen's Nurse in 2018. Michelle, it's all yours.
Thank you, Roger. Firstly, I'd like to thank Dr. Katie Gardner for inviting me here today. After reading the book, which took me 4 evenings to read, I realised that I was just a very small drop in the ocean of the history of Princes Park Health Centre from 2002 to 2006. And the book is so interesting. I wish I'd known some of the history, I think, before I started there, right from 1950, as Katie said, to the current practice that moved there in 1977 up to the present day. So it was wonderful to be asked and be part of something so special, and it really is. It's like a novel in parts, reading some of the stories. So thanks again for inviting me. When Katie asked me to be part of it, I had to think back to where it all started from, and there was a job advertised for a social exclusion team manager, and I read the person spec obviously, and I knew that I wanted this job more than any job I've probably ever wanted, that I knew that I could make a difference at Princes Park and for the citizens of Liverpool, but particularly from the Black and ethnic minority communities, because I understood what the issues were. I'd previously worked at Everton, Great Holmes Street practice, and worked with thousands of asylum seekers that moved into 2 tower blocks, so I knew that I had the skills and expertise. But one thing I did say, I was interviewed by the lovely Gideon Benthoven and Margaret Thompson from Public Health, who's now deceased. One of the things I did say is if I'm successful in this job, I'd like to change the title from social exclusion team to social inclusion team, because I wanted an emphasis on the inclusion, not to reinforce the exclusion that our communities faced. And obviously that's where the whole social inclusion team was born. And probably one of my proudest experiences in my 25 years of working in the NHS was at Princes Park. I think one of the accolades of the team is at one point we had 23 HealthLink workers representing the communities of Liverpool, and I don't think I've worked in a team, I know I haven't worked in a team since where we've actually said what we aim to do is to represent the local communities. We had people from Serbia, Croatia, Somalia, Chinese, Portuguese, French Lingala. We really did try to be a world in one practice, not just a world in one city, but it was a world in one practice. When I think of the amount of people that we were supporting. And we weren't just supporting the patients at Princes Park, we were supporting patients of other practices from Princes Park right across Kensington, Islington, Everton, Smithdown Road area, parts of Dingle, because in 2002 is when the National Asylum Seeker Dispersal Programme also came into effect. That was in 2002. So we were supporting a lot of the asylum seekers in the various accommodation where they were situated throughout the city, including Greenbank Court and Greenbank Drive. So it was a really special time. So I think we were a victim of our own success in terms of we got too big for the Portakabin in Princes Park. We managed to be there for 4 years, from 2002 to 2006. And then we moved to Cwmbra Marni Millennium Centre on Princes Road. Stayed there for about 5 or 6 years and then transferred to the lovely Abercrombie Health Centre where they were up until recently, I believe. And I think the team are somewhere in Kensington now. But again, still with the same ethos of supporting newly arrived asylum seekers into the city, but it's now extended, obviously, and it's all disadvantaged people who experience discrimination or barriers to healthcare. We've also employed an Irish traveller health link worker and somebody to support the deaf community because we identified that they were also being disadvantaged and not accessing services, but would rather potentially access A&E rather than primary care and go through preventative services. I think key to the success of the role was the partnerships that we made with local organisations such as Refugee Action. And I saw a lady called Julia Nelke on the screen earlier. I don't know whether she's still on, but I remember working really closely with her. She had an organisation, Victims of Torture, and a lot of our communities, obviously, they come from war-torn countries and they really were traumatised, and we didn't have services at the time in 2002 that we could refer asylum seekers to quickly and efficiently, because often by the time they got through NHS services they would have either been deported or moved on to another city. So having close links with an organisation such as Victims of Torture, we were able to get people seen quickly and access services, which was much needed at the time when I think of some of the atrocities that communities had been through. I remember we had an issue in the city, and we probably still do, around female genital mutilation. We had the 1985 Prohibition Act of female circumcision. I remember going to Katie saying, I think we need an identified worker to address some of the issues that our women are facing in the city due to female circumcision. I remember Katie being very, very stern in her response and said, Michelle, it's mutilation. Let's not get all cosy around what the title is. It's not circumcision, it's female genital mutilation. And again, with the support of Liverpool Primary Care Trust, who I was employed at the time, it was very easy to put a business case together, and we had our first female genital mutilation advocacy worker, Rahima Farah, and she's still employed to this day in the same role, supporting women who are impacted. And that was ahead of the Female Mutilation Act that came in 2006. So as you can see, as issues were surfacing within the community, it was really easy to put a business case together. I had the autonomy, I had the funding, and I had a whole team that wanted to see ideas come into fruition. I think the success of the team is that 22 years on, that team is still in existence. And as most people know who work in health, initiatives come, initiatives go, depending on funding streams. We've gone from a central Liverpool PCT to Liverpool PCT to Merseyside Clusters PCT to Liverpool CCG, and the social inclusion team has survived all of those different NHS bodies and is currently now with Merseycare. So I think that is part of the legacy and part of the success of the team, and it continues to adapt and meet the needs of local communities, but also addressing the issues of some of the newer communities that are arriving into the city. So I think that's probably what I'm proud of, is that it is still in existence. But on the other flip side is, why do we still need a social inclusion team? Because we know that, historically and today, that racism and discrimination still exists within health services. So it's a bit of a double-edged sword. I'm glad it's still there, but 20 years on, we still need a team like that to address the discrimination that we see. But thanks, Katie, for the book. I will certainly be buying it for gifts for people who will be interested in some of the stories that are in there. And thanks again.
Thanks very much indeed, Michelle. Our final speaker is Michael Ejanashe. Michael qualified as a doctor at Liverpool University in '86, became a GP in '94. After some time at Princes Park as a trainee, he returned to the practice as a partner. He left in 2007 to join a practice in St Helens. Michael's been involved in clinical commissioning for 10 years. He's now medical director and deputy chair of St Helens NHS Clinical Commissioning Group. And he makes the point that the NHS long-term plan emphasises a holistic, collaborative population management approach, pointing out that this was exactly the model that the team at PPHC strived to deliver over 30 years ago. Michael, the floor is yours. You need to unmute yourself, Michael. Michael, you need to unmute yourself. Do you know how to do that?
Yeah. Sorry, I am clicking on the buttons too many times in my excitement to speak. So I hope you can hear me now.
Yeah, fine.
Yeah. So thank you, Roger, for that lovely introduction, and thank you, Katie, for inviting me to be part of the panel. I arrived for the first time in Princes Park in the early 90s, really uncertain what I wanted my medical career to kind of be involved in. I didn't know whether I really wanted to be in a specialist specialty or general practice. The fact that I've been a GP ever since speaks to the impression that Princes Park made on me as a young doctor back in the 1990s. The enthusiasm, the camaraderie, the commitment of every member of the team, I guess, was inspiring. I recall with fondness the evening practice meetings around the fabulous Thai takeaway meal, Saturday morning surgeries, which were, not the most kind of the thing you want to look forward to every, as the start of your weekend, but it was always made bearable by the lovely toasted homemade bread and butter for breakfast. I also recall our on-call mobile phone, which was the size of a briefcase that took about an hour to be fully charged and lasted for one phone call from a patient before you had to sort of hurriedly get home to put it on the charger again. The memorable people I met as colleagues and patients have stayed with me for the rest or for most of my life since I left Princes Park. I particularly remember one of my elderly female patient from the Middle East who had lived in the UK for 40 years and had been a patient of mine for about 10 years. When one day she said to me, why have you not learned to speak my language so you can communicate more easily with me? So that was something that left me kind of, reflecting for several days after. So these were certainly most, some of the most interesting experiences amongst those that were obviously outlined in this fabulous book. Like Michelle, it was quite an education for me to revisit, just the history of Princes Park and the landmarks and that preceded the forming of the health centre, and the kind of inspiration and the innovation that has since taken place over the last 40 years. I also kind of had some also quite interesting experiences. One was being out one night on a house call, probably in the early hours of the morning, driving very slowly because I wanted to find a number of the house. And I remember being pulled up by the police who wondered what I was up to. So that was the kind of an interesting experience for the early 90s in Liverpool 8. But most of all, I remember the commitment to the building of a multidisciplinary team to tackle the wider determinants of health. The corridor conversations with district nurses, health visitors, counsellors, link workers, the social inclusion team that Michelle talked about, just before I started speaking. I was so kind of, I suppose when I eventually left Princes Park and went to work in St. Helens, it kind of reminded me what a good place I'd been working, because I'd gone gone from a team which actually had this kind of wide approach to health provision to a setting that was very much sort of several years behind, and we have since actually been trying to catch up in St. Helens. The other kind of memorable thing was the fact that, sort of not only were we building or working within a multidisciplinary team at the health centre, there was also great collaborative work with our colleagues in secondary care, colleagues in public health, and most importantly, colleagues in other neighbouring practices, trying to share good practice and actually better ways of delivering healthcare. So fast forward to now in 2021, we now have revisiting the concept of primary care networks, which are groups of practices sort of encouraged to work together to deliver care to populations of 30 to 50,000 patients. We have what is now called an integrated care system for the whole of Cheshire and Merseyside, with a instruction and a duty to collaborate. We have, collaboration between health and social care. In St. Helens, we now have, sort of us in other places within Cheshire and Merseyside, integrated care partnerships, which are also being brought together to address the sort of wider determinants of health, because we know that for 80% of those who present to their GP or GP practices, the intervention they require you wouldn't find on a prescription card, and it's all to do with sort of lifestyle and the social environment in which people live and work. In our patch in St. Helens, we have established an overarching board with representation from health, community providers, state sector and voluntary sector, to ensure that every St. Helens pound is spent in the most efficient way possible. Just the kind of thing that Princes Park wanted to achieve back then, 30 years ago, when I first arrived as a GP trainee. We've also agreed within, sort of this bigger context of a Cheshire Merseyside wide integrated care system, that, to ensure that things remain relevant on the ground, that you need that close collaboration that was part of the ethos of Princes Park, to ensure that the voices of the residents in the local place that you seek to work or deliver healthcare to is understood and properly addressed. So I'll kind of, I suppose the final reflection is that, as we go forwards, as well as doing all of those things, we want to make sure that we have our communities empowered enough to be able to make decisions that are in the best interest of their health. I think without that, we probably will be fighting a very, very, very hard battle.
Thank you, Michael. Good to hear from you. We've now got about 40 minutes left for discussion and talking, and people can, of course, come on live if you like, but a lot of things have been coming up on the chat. Interesting. This is really all about patients. Always has been. Denise Kennedy writes, I've been registered with PPHC since I came to Liverpool in '87. I have to say that since Brownlow Health took over the running of the practice, it has been an excellent service. Accessing appointments and healthcare has been amazing, especially in the last 3 years during my cancer treatment. PPHC, you are amazing. I don't think we need to respond to that. I think we all know it. And Roderick, thank you for this. So inspiring to hear about patient support groups organising to ensure that they receive the health service that they deserve. Steve, Mummy wants to comment, and do, as I say, you just put the hand thing up and we'll be able to get you to come on actually so we can see you. But Steve says, can I comment how important the example of PPHC is in providing positive initiatives for Liverpool 8 and working as a group regardless of organisational boundaries? I wonder if anyone wants to pick up on that, because I believe really strongly that Princes Park Health Centre helped to create lots of other things and still does. I'm thinking of things like the Law Centre, particularly post-81, but I'm sure there are things now that are helped by PPHC. Oops, Steve wants to come on. So what do I do? Is that what I do? I think I'm doing the right thing. Steve? Yes. What do you want to say?
Yeah, two things, Roger, really. One, Liverpool 8 has lots to be angry about, and people working in the NHS and the patients have a lot to be angry about. But I think it's really important that we celebrate the positive. And what was amazing about Princes Park Health Centre was it provides, I think, quite a life-affirming example. You read the book, and it's fantastic. And the other thing that struck me, just to reiterate the point, something I tried wearing my hat as a counsellor to think about how you do right. There's two things that matter. One is that you care about the people you work for, but also that you build teams and sod the organisations that you work for. And that's what really comes over in the book, and it's so important in terms of public service, that here was a team of people over the years who worked together for the good of patients and the community, and worked as a team. That's sort of easy to describe, but difficult to do, but it's so bloody important. And it's not about vertical organisations, it's not about being top down, or it's about listening to people and working as a team. And doing that is amazingly important, and we should never forget the importance of it.
Anybody want to pick up on that? Thank you for that, Steve. This is Leslie, SM Mahmood. Hi, Leslie.
Hi, Roger. Hi, the panel. I'll just switch the video off because I've got a very poor connection. Yeah, it's a fantastic example of working together, working for the community, and it's just an amazing story. I would just address two comments to both Michael and Katie, because although I agree with Michael about the social determinants of health, I disagree with him that if he thinks that the integrated care systems that's coming in the new NHS bill will really work in the interests of patients and local areas, because I would refer to Katie's remark about what's really on offer. We've seen recently that a giant corporation, Centene, has taken over 59 GPs surgeries, and this is all part of the plan that's coming down the line with the new legislation that will make integrated care systems, one integrated care system for the whole of Cheshire and Merseyside, and another 41 regions across England. Health campaigners feel that this bill just aims to privatise the NHS at all levels and would prevent the prospect of any kind of development like Princes Park in the future. We could have Centene, Virgin and other private corporations sitting on decision-making bodies, or actually running the whole regions of the NHS. So I'd just be interested in, I know Teresa's view, so I'm not going to ask her, but I'd be interested in the, particularly because Michael's referred to it, and obviously Katie's, lifelong health campaigning. Obviously, if Michelle wants to throw in a comment, that would be welcome, but it's aimed particularly at Katie and Michael. Thank you.
Thanks, Leslie. Michael, do you want to respond?
Yes, I know that there are such anxieties that have been, and examples that have been quoted about the opportunities for private companies to profit from integrated healthcare systems. I suppose there is always that risk, and what we in St. Helens, and I would give St. Helens as an example of how things could be, how you could retain the relevant localism within such a big system, is that if you've got local people and local practices and local professionals having a robust enough place-based system, because I mean, I'll take St. Helens as one of the places within Cheshire Merseyside. You could potentially have sufficient delegation to that local place to ensure that the kind of threat of a local company taking over several of primary care would not happen without the wishes of the people that's actually there and seek to experience that kind of or will be the recipients of healthcare within our system. So I think what you make of your local place is actually going to be as important as the duty for health and social care to kind of have a seamless way of working together to meet the needs of people. So I would say the antidote to that possibility is that if you've got sufficient localism and powerful sort of organizations on the ground whose voices can be listened to within their particular places, then the threat of those kind of things is likely to be not entirely diminished, but will be significantly mitigated. So that might be my naive view, but I passionately believe that that's one way you sort of prevent that kind of thing happening.
And Katie, is that naive, that view?
So I think it's no. I think it's crucial because there's two aspects. I mean, I'm opposed to the white paper, and I fully support the campaign which Leslie is involved with, which is actually part of the Save the Women's Hospital campaign, and is now campaigning against the white paper. But at the same time, realistically, on the ground, it's so important that that we work together, because the thing that Princes Park did was just forget about, well, we're called this, we are, we're a link worker, we're a GP, whatever it is, a community development worker, whatever. We've got a problem, we want to work together, and we want to solve that problem. And I think that's what Mike is talking about in St. Helens, and hopefully, that's so wonderful, a sort of bit of a legacy. And that you've got to keep that focus on the ground now, because so you have to do work across all fronts. I mean, I'm very confident that if something happened, for example, when Princes Park Health Centre comes up for the contract comes up for tender again in 2022, which is another year, if the powers that be, whoever they might be trying to, put it out somewhere, I think there would be, I'm confident that the people of Liverpool 8 will come together to challenge that. So I think you've got to kind of campaign on a macro level and on a local level, but as well keep working on the ground and keep working together and cutting through boundaries.
Do you want to add to that, Michelle, or you're right?
No, I've got nothing further, thank you.
Cambiza and Anna have got their hands up. Cambiza.
Hi, I think Cambiza is just doing our cooking, but I'm Anna. We're both being GPs in Tower Hamlets, and I remember when Katie was a medical student at the London Hospital where I was, but she was a senior medical student, and I tried to seduce her into the new women's group, but actually I think she was working at Oxford House and in the community even there as a student. And certainly Princes Park was very much a model and an example. We were all inspired by what was going on, and many of the people, like for example Sheila Abdullah, who was involved in the abortion campaign, many of the people working there were very inspiring to national campaigns and needs. And I think what has been great is the tremendous community involvement and the tremendous integration of the team. That isn't necessarily easily replicable. And I feel, you know, that Michael, I think you're really rather unrealistic. We've had 2 surgeries nominally, but in fact 4 being passed through 18 medics into 17 now. And the building that the CCG, which now ceased to be the CCG because it's no democracy at all, it's gone out to the whole of East London, has earmarked for that practice, is in a yuppie end of Tower Hamlets. It's somewhere that the wealthy young people and bankers, and there are some left, live. And we're losing to a whole practice from the more deprived, more Bangladeshi area. And people are concerned in the community, but we don't really have the strength of organisation in the community, I think, that you've had. And I think the other problem is that, you know, doctors can develop schemes, healthy living centres and things, but many of them can be drawn into these more progressive versions of what are semi-privatised things. And I think in the current climate, with cuts, with COVID, with the removal of any notion of local answerability or democracy, we've really got to fight hard for our NHS, and fighting against Centene is part of it. But I really would like to say that from Cyril Taylor onwards, we've really been inspired across the country by what you've all done in Princes Park, from the teamwork and multi-ethnic work and so on to the medical work. And I do remember Katie, whom I don't know very well, but I have known you very long, groaning about the long working hours and other people reporting it. But I too was one who went home at about 11 or 12 o'clock in the East End quite often, so I know the feeling. Thank you very much for inviting us, and for both you and Susie, who I also know, for doing the book.
Thanks a lot, Aaron. Anybody want to comment, or move on to somebody else? Okay, Sylvia Hykins. Can
you hear me?
Yeah.
Oh, great. Okay. Well, first of all, yes, Princes Park Health Centre, fantastic, and it's wonderful to hear that Ed Gaynor and Brownlow are now in there, and the whole thing is integrated and alive. But you know, this 2021 proposed bill for the health service scares me silly. Where is the patient voice? As you know, I used to be chair of the Community Health Council in the 1980s. In fact, Jenny Murray on Women's Hour BBC called us the most radical CHC in the country, and I was proud of that. But we need the patient's voice, and it terrifies me that we have got American insurance companies about to take over groups of GP practices, and there will be panels that will decide who gets referred for hospital treatment, and they will be representatives from those insurance companies on those panels and taking profit from the NHS. This is another step towards privatisation of the whole thing. And, you know, we want the patients to have a voice here, and as well as all these wonderful medical and social workers and all the rest of it. And I'd like particularly to hear Mike's opinion on that, as he is in with the commissioning. Where is the patient's voice? I don't hear it or see it anywhere.
Okay, thanks for that, Sylvia. Michael, the challenge is yours.
Thanks, Roger. Thanks, Sylvia. I don't want to come across as someone who wants to kind of defend the white paper. What I want to actually kind of portray is reflect on the challenges to the health service and social care has faced. The reality is that we don't have, or there isn't, and I think the book actually kind of touches on this. We don't have an unlimited purse, nationally or locally to do what we would like to see happen. So it's about thinking about how is the most effective way of actually making the limited resource we have go the furthest. So in terms of, I think most people fundamentally, I believe, don't have an argument with integration. as far as health and social care are concerned. I think the arbitrary kind of division that we've seen in recent years has actually led to some of the problems that we currently see. And what Princes Park tried to do was actually sort of break down those barriers, and so that the experience to the patient was seamless, and not you didn't have this bit about well, it's not health, it's social care, or it's not social care, it's health. So I on that basis, I think it actually makes ideological and fundamental sense to me. As far as the patient's voice is concerned, and that Sylvia kind of alludes to, yes, that's always going to be a challenge. But I think, again, in taking St. Helens as an example, within the integrated care partnership that we have, there's going to be democratically elected members that actually are involved in a sort of how things turn out and how things shape up. There will also be lay members within those boards that actually represent the patient's views. Each primary care network will be encouraged to actually have their own patient participatory groups, which will fit into that. So again, I come back to this, the stronger you can have a local voice within that integrated care system, the more sort of assured or reassured that you can be that things will not happen without the explicit consent of the population that people are trying to serve. There is always going to be these scare stories about privatization, and that's always been the case for as long as I've been in the NHS. But so far the NHS has endured, and yes, there's always going to be the threat. And I'm not here to be a champion of integrated care system, only to say that there is something about looking at provision of health services in a joined up way that makes the patient experience as sort of as smooth and as seamless as you can make it. So and that's my goal. That's what drives me, and that's what inspires me.
Okay, Michael, thank you for that. Colin Watts is online.
Right, I've unmuted. Can you hear me?
Yep, got you.
Yep. Okay, thank you. I remain extremely concerned about what is happening. I think it's amazing what over the years how the health centre has recovered, and I want to take Mike to task at the beginning because he said the rise and fall and he didn't put the second rise in. But that aside, I think we're all surely aware of the correlation between extreme poverty and extremes of ill health. And it seems to me that despite all the fantastic efforts that people like Teresa have been able to do in galvanizing public opinion, it's always in the poorest areas that people are the most vulnerable and the least able to stand up. And they're the people that corporate interests on the whole do not listen to, because they're out there to make a profit. And it really is as simple as that. And okay, there are great private companies, I don't deny that, but there are terrible private companies, and they are still there to put to make profit, and their main concern is to their shareholders and their investments. And that, to me, is not a basis for a national health service. That's me.
Very clear. Thanks a lot, Colin. Layla Saeed's on now. Hello, Layla.
Hi everyone. My name's Layla Saeed, and I'm on secondment at the moment, but I used to work for the social inclusion team, which is Michelle's legacy, and I just felt like compelled really to kind of bring you up to date on where the social inclusion team is at the moment. I'm not aware of anything that is going on in terms of the white paper, but what I want to say and what I want to pledge is that we will carry on the social inclusions team's work and being a voice for the underrepresented. We've done it during the COVID pandemic, where there was a low uptake of COVID vaccines in our minority ethnic groups, and we've organised pop-up clinics within the community, and also we've supported Central Liverpool Primary Care Network in engaging with our communities. So if we could help in any way. And I speak for myself, and I also speak to Rahima Farah, who's not on the call today. But we are really passionate about carrying on this legacy. We've done walking groups from Princess Park Health Centre. We've also done Tai Chi sessions for women in Princess Park Health Centre. And that was out without kind of knowing that history. That was so rich in that book. And I think reading that book has motivated me even more, and also the social inclusion team to really, you know, further commit to that legacy and to carry that on. So
okay.
Thank you for Michelle as well.
Katie, you want to pick up on that, I think?
Yeah, I think I do. And thank you so much, Layla. And I'm just about to try your fabulous Arabic scouse recipe, which was in the Merseycare newsletter, and it's inspired me. So I think that is a key thing, because I definitely oppose the white paper, and I've been very bad at not getting so involved in campaigning, but now that I've finished the book, I want to get involved more. However, on the ground, I suppose it's about, life must go on, and we must do things that are sort of tangible so that we can feel empowered and feel positive. And during COVID, I've been part of a WhatsApp group, Liverpool 8 Organisations WhatsApp group organised through the Cumbria Marnie, and it's been absolutely wonderful. The social inclusion team is part of that. I would look at that group as, a problem arises, somebody puts it in, people come in, and the problem is quite often solved. And it's been, very, very inspirational. And I know that the primary care network is linked into that. And something that I'd like to do going forward is to make sure that those links are really, really strong, and that they don't, it doesn't become the primary care network's a new institution and it's set up and it's going to have patient reps. It must totally connect in with local organisations in order to really make a difference sort of on the ground.
Katie, and thank you, Layla, as well. Before we go to Alex Scott Samley, who wants to speak, there are just a couple of things on the chat I'd like to get across. One is, can you help Alex? He says this isn't really, or she, I'm not sure, this isn't really a question for anyone, but rather, well, I'm hearing about all this great work in terms of languages and all that. I'm a Portuguese interpreter who lives here in Toxteth since 2008, and not even sure who I could contact to offer my language skills free of charge, just to help if the need ever to arise. Would be great to assist the community doing my small little bit. So yeah, not a question. Apologies if this isn't even something I should have bothered you with. Well, there may be somebody who can help on that. Is there anybody?
Yeah.
Michelle?
Yeah. So Liverpool were very keen to ensure that all patients had access to not just face-to-face interpreters, but telephone interpreting as well, both in primary care and within secondary care. So various organisations were approached and we commissioned a service, and every GP practice now has access to interpreters for over, I think there were 65 languages spoken in 2018 within the city of Liverpool. So that's really important in terms of the quality of information that is imparted from the medical profession to patients, but also that they can communicate as well their needs. So it's not a case of just being able to speak the language. There's actually a proficiency test, and I think it's level 3 that they require at the moment of interpreting the language services. So if the gentleman wants to leave his details with me at the end or put his details within the chat box, I will get them and put you in touch with the current provider of interpreting and translation services for Cheshire and Merseyside, if you would like to be an interpreter.
Thanks very much indeed for that. Alex Scott Samuel, let me find you. There you are. Hi, Alex. You've got to unmute yourself, Alex. You might not be able to see it because, as we all know.
Okay, can you hear me now?
Yep, fine. No, you've got to mute yourself again, Alex.
Oh. Can you hear me?
Yes.
Yeah.
Oh, okay. First of all, can I say how great it is to be here? I know practically everyone on the list, and it's like seeing your history written in one place. I'm old enough to have seen Roger when he was acting at the Playhouse, and I was proud to have been one of Cyril's patients from 1968 to 1983, when I moved out of the area and they wouldn't let me stay on the Princes Park list any longer. But of course, I remained very involved much after that, and still campaigning with many of the people here. But before talking about campaigning, can I just say, I think this is all about celebration, this book. And we Princes Park lovers, including Michael, of course, even though his views are a bit like the UK in the Eurovision Song Contest, nonetheless, for the purposes of this call, as Katie is reiterating, we all love each other, and love is bigger than neoliberalism. So I'd like to start by just celebrating the values that informed Princes Park, because people don't often talk about values and ideologies. Being British, we're all too embarrassed to sort of name the word, as it were. So let's celebrate anti-racism, let's celebrate feminism, and let's celebrate socialism, because those are the values that informed the foundation of Princes Park Health Centre and that keep it and all of us alive, Michael included. So just moving on slightly, as I say, with many people here, I spend most of my time these days campaigning against integrated care services and the awful philosophy they represent. As Michael says, who doesn't want integration? But integration in that phrase are weasel words. They sound like parenthood and apple pie, but they simply mean integration between the private sector and the public sector. They're nothing to do with seamless cooperation between health and social care, which is something that we all want. You only have to look at the people who are pushing this, whether it's Simon Stevens, who at United Health went to the World Economic Forum in 2012, where he got the ideas written by McKinsey about how to undermine public health services throughout the world. And we're the guinea pig for that. To the people in the present government, I can almost guarantee that everyone on this call, including Michael, detests everyone in the present government. And those are the people whose values are represented in integrated care services. So I won't waste any more time on something we all agree on. If anyone doesn't know already, just go to the Keep Our NHS Public website and click on campaigns and then on integrated care services. And there's a set of wonderful papers there, many of which were written by friends, colleagues and comrades from Liverpool, as well as other parts of the UK, to inform that campaign that we all need to join and fight for. When the new health and care bill announced in the Queen's speech comes out in the next few weeks, please, 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 even if your name is Michael, join the campaign against it. Otherwise, it won't just be the end of the NHS as we know it. It will, as has been said already, be the end of Princes Park.
Alex, thank you very much indeed. Unsurprising what you said. Oh, Katie wants to pick up on you. Hello, Katie.
Hi. I just like to defend Mike, because actually we had a conversation before, about a week ago before this meeting, and I think that I would just like to go back to say that he totally convinced me that within the structures that are currently available, I think it sounds to me from talking to him that actually St Helens is quite a long way ahead of Liverpool. And of course, to me, that is because Mike is very involved in St Helens CCG, and he learnt his craft at Princes Park Health Centre, and so now it's passed on to St Helens, and Liverpool is a bit left behind in terms of really trying to drill down and work with local organisations and grassroots organisations. So that is a kind of a defence. And then I wanted to be very naughty and just mention something that's really important to me, that out of writing this book, I became aware of an organisation called GPs in the Deep End. And for me, that is another sort of kind of a hidden legacy of Princes Park, because this is an organisation founded in Glasgow based on doctors who've got inequalities in access to healthcare and inequalities in health. Michael Marmot's right at the core of their beliefs, and there's groups of practices up and down the country that belong to GPs at the Deep End, and they're all working together in their own ways at a local level with local organisations to solve problems. I'm sure a lot of those GPs, well, I know that they are, because Harry Burns, who's one of the who was a professor of, I think he was a minister, or he was very important in Scotland.
Chief Medical Officer.
Yes, public health in Scotland, is totally, we're definitely not in favour of this government, and inequalities in health are absolutely at his core being. Anyway, the GPs in the Deep End organisation has really inspired me because it's partly, we've had COVID, and there's some opportunities that have come out of this whole seismic shift in primary care, and loads of GPs are wondering, how can we go forward? What is the way to go forward? And I think the GPs in the Deep End definitely embody our values that we had at Princes Park, and they offer ways of practices working together in deprived areas, of not feeling sort of totally isolated and alone. So that's just a little bit of hijacking, sorry.
Right, nicely hijacked. I've got 2 more people to get on, and we've got 5 minutes left. So as briefly as possible, Tina Atkins is next. Hello, Tina.
Hi, thank you for that. It's really interesting conversation. I just want to say 3 things, please. So I'm the management partner in Brownlow Health, and I just want to say thank you very much to our fantastic team in Princes Park, led by Dr. Debbie Faint, who are doing a fantastic job there every day. Really proud of all the work we do there. The second thing I wanted to say is I'm the non-clinical lead for Central Liverpool Primary Care Network, and we've just had an away day today, and everything we're talking about chimes with what we've talked about in the away day today. One of the priorities we've set as a network is tackling racial inequalities, and we're working with social inclusion team, Cumramani Centre, PALS, many organisations in order to achieve that. And the third thing I wanted to say is we've got a patient participation group for the network, and we're really encouraging people to engage and get involved with us. So if anybody's interested, please go to our website and get involved. We want to hear you. We want you part of the solution. Thank you.
Tina, thank you, and thank you for being so brief. I've lost Camise because he was going, where is he now? You gone, Camise? Yes, yeah, unless he's coming back. Let me just, Kim Johnson's the MP for Wavertree, and she has written this. I'd like to thank Katie and her colleagues for writing this book and telling the amazing story of Princes Park. It should be an example of best practice and recognising the community partnership that enabled it to work so well. Let it continue for many years to come. Well done to all former and current staff for the work they do in supporting the community. And I think I've got Camby's back now, and he'll be our last caller, I'm afraid. Camby, it's over to you.
Okay, yeah, I just wanted to reflect a bit on the balance between what individual GPs do in their surgeries and what the mass of us do in mass struggle, really, because I think this has always been a dilemma for me. And I think there's a link between the two. So when we all started, you know, John Robson, myself, Anna in East London, and Katie and so on in Liverpool, we were always trying to do good in our own practice, but also being aware that what we were doing in one practice couldn't just create an island of socialism, that it had to link into that broader political struggle. And as the Princes Park thing has straddled a number of decades, I think it's worth briefly reflecting on where we are now to where we were then, when Katie, Anna and me and all of our generation of young doctors qualified in the 1970s. And at that time, I qualified at the end of a junior hospital doctors' strike that was campaigning for, you know, against those long hours that we all worked in those days. And the people that were campaigning then in that junior hospital doctors' strike didn't really hold much for the NHS. It was often the surgical registrars and so on who were more in it for the money that fought. And if you contrast that with the junior hospital doctors' strike recently, who have been guided, and all the stuff that Katie has done and Princes Park has done has created a sort of socialist mentality that has become the norm now for young junior doctors coming forward. So when they fought for their pay and conditions, they didn't just fight for themselves, but they fought for the NHS as a whole. And that, I think, is a real difference between now and then. So although we're faced with the same struggles, how to do things individually that will take our own local population forward, I think we're actually in quite a good place at the moment. I think that the next generation that's taking over from us are starting from a much better footing than we started from in the 1970s. And I think it's a tribute to Katie and all the others that have done stuff in Princes Park that we are where we are. And just looking at the Tories tearing themselves apart with Dominic Cummings ripping into Boris Johnson on the news today looks to the divisions in their side and the strength that we've got on ours. And I think that's a good place to sort of be in at the moment to go forward. So thank you, Katie, for all that you've done.
Thank you, Cambies. And Wendy Savage, great campaigner, is on the line now.
Well, good evening, everybody, and thank you very much, Katie, for inviting me and sorting out the technical problems. It is inspiring to see that Princes Park has managed to survive despite that glitch. But I would just like to say to Michael that please, GPs, do not fall into the same trap as you did in 2012. In 2012, when Andrew Lansley brought in his health and social care bill, GPs were promised that they would be in charge. They're not in charge. Although they're members of the CCG, they, in almost no area have they been able to resist the system. And this integrated care system, not something that we want to happen, is a real threat to the NHS. And as president of Keep Our NHS Public, I would advise you all to go to our website, Keep Our NHS Public, where there's lots of information. We've got to get people involved in this and get them to talk to their MPs, because the government have got such a huge majority, they can get anything through Parliament. And unless we can get these red wall MPs to see the light, I see no way that we're going to win this battle. But I think Alex has said clearly that this ICS system is not about GPs collaborating, even though that's the way it's being sold to the GPs. It is about bringing the private sector in. And Michael sort of said, well, you know, been talking about privatisation ever since I've been a GP. Almost 20% of the NHS budget goes directly to the private sector. And this COVID pandemic has shown exactly where this government thinks the way to go forward is. Look at the 37 billion given to a privatised test and trace, which they have the goal to call an NHS track and trace, and not given that money to the public health people who knew how to do it, but whose labs have been run down over the last decade. So we've got a real fight on our hands, and it is hard to get people to demonstrate and get involved in reorganizations of systems. They'll march for hospitals like the Liverpool Women's Hospital, but they won't march for system change like this. And this is a real threat. Now, in Islington, our Keep Our NHS public branch has taken a judicial review of the decision to give the practices, North Central London, to give the practices to Centene subsidiary Oprose. And we've got a counsellor who is going to be the person doing it. If you feel rich, then go to the crowdfunder, because we're raising money for that. But this is a dangerous, dangerous thing that has happened with these AT medics, half a dozen young doctors who thought they could have a good system. And they came to talk to our local BMA branch, and they said, well, we got so big that we needed to have somebody to deal with the back office systems. Is this the sort of GP you want? No. And they could have not got so big and not needed so much back office system, but they chose to sell out at a great profit to Oprose, which is the Centene subsidiary. So the NHS is under great threat, and they sell these things. So the GPs think, oh, this is good, we're working with other GPs, etc. But that isn't the real story. And we've got to be alive and awake and fighting, and we've got to stop this. And I've listened to Dominic Cummings today, 5 hours of it actually, and it's extraordinary, the dysfunctional goings on at the heart of government. But think about it, 47 million people voted for Trump, and all those people voted for the Tories in the last election, despite the fact that Boris Johnson is a known liar, philanderer, and generally lazy bastard. And I just think we're up against it, and we've got to fight. And thank goodness we've got lots of people trained in the way that the Princes Park Health Centre showed us they could be trained. And I hope Canvas is right, that we're going to have enough young GPs to make sure that they can keep the show on the road. So join Keep Our NHS Public if you're not already a member. And I'm going to buy a copy of the book, and I hope you all will too.
Wendy, thank you very much indeed. Just to remind me, it is a beautiful book. That is it. Please, please buy it. Thank you to all the guests, all of you rung in. I'm sorry to the ones we didn't get to. And I'm going to hand you back now to close the occasion to Mike Morris from WOW, which of course is the people behind all of this.
Thanks, Roger. And thank you to everybody who took part in this superb discussion. And special thanks to Katie, Michael, Teresa and Michelle for their contributions, and for everybody for the questions, etc. I think it was fantastic. And, you know, I think it's a really educational thing, which the book is superb and, you know, is recommended reading. And we've been really, really proud to publish this book. It's now part of a long line of books that we've published, all aimed at giving a voice and providing a platform to people to tell stories that otherwise wouldn't be brought to the attention of the public. The Princes Park book aligns perfectly with our mission and ethos as a radical, socially engaged arts organisation. Huge congratulations to Katie and Susanna for writing the book, and also to Maddie Robinson for cover design. As Roger said, it's a fantastic and beautiful looking book, and Lee Philpotts for layout. And thank you to Katie and Susanna for approaching Writing on the Wall to be the publisher. And I would echo what Roger said, you know, with this amazing book, Go down to News from Nowhere if you're in Liverpool, our favourite independent bookshop. You can also buy it online. So if you can't get to Liverpool, or you can order the hard copy online through News from Nowhere as well. And so you'll be doing two things, buying a fantastic book and supporting News from Nowhere as well. This month, by the way, we've also published Littlewoods Pools Girls by Joan Boyce, which is the first book. I'll just show you that because that's another beautiful book that we just published, available from News from Nowhere, which is the first book that we're aware of that gives a voice to the many thousands of women who work there and who made up the majority of the workforce. So just in closing, I just want to draw your attention to what's happening for the rest of our festival. A couple of days left to go. We've got Mandrake Petals and Scattered Feathers, a collection of dark folk psych stories from Dave Ward being launched. Gary Young and Paul Mason discussing the rise of the far right and how to stop it. A radio play by one of the audience tonight, a radio play called Paul Robeson's Love Song by Teo Aluko. We've got Legacies of 81 with Lord Boateng, Maria O'Reilly, Wally Brown, Professor Gus John, and my co-director Madeline Hennigan taking place, which also features an exclusive performance from legendary reggae poetry pioneer Linton Kwesi Johnson. We then have a book launch of Miss Death, Mrs. Death by Selena Godden, and there's also a couple of walking tours at the weekend around on the subject of William Roscoe and Kitty Wilkinson, and all of those details can be found at writingonthewall.org.uk. After this event, you'll be sent a monitoring form. Please fill it in and send it back to us. It helps us to understand our audience and to continue to create events that engage with people across this region, and because we're online, maybe internationally as well. Special thanks to our staff and volunteers, our funders, the Institute of Creative Enterprise at Edgehill University, Arts Council England, and Liverpool City Council. And as I say, if you want to find out any more about us, you can check out our events on the website. And that, if you go through there, that's where you can find a way to order the book as well. Really enjoyed this event. It's been a real highlight of the festival. Thanks to everybody. Have a good night. See you soon. Take care.
Solidarity.